Today I wanted to talk to you about a new thing that we've launched. We've actually had our first one, but it's called our CCM meeting. And you're like, what's a CCM meeting? A CCM stands for Collaborative Care Meeting. And now that we're offering 4 services at Cutting Edge, so that would be occupational speech, physical therapy, and ABA services, and we are adding LPC in the near future in early 2021. We wanted to be able to develop a way, since our model is collaboration and we know the value of all the caregivers working together on the same plan so that there's generalization of skills. We plan a meeting, and it's a minimum of twice a year. And this meeting is actually called by the BCBA, and they will coordinate the occupational speech and physical therapy providers. Um, Typically, if we're scheduling this meeting, we may not be able to get, if you're seeing multiple providers, we may not be able to get all of them to the meeting, but they're going to designate one person. But every provider will fill out a form that the BCBA sends out with feedback. So you're getting that one person from the profession that's disseminating the information is collecting information from all the providers in that discipline. So we call this meeting, and the CCM team, the ABA team, the OTP team, speech, depending on the services you have, will meet for 30 minutes. The BCBA is going to present a document to them, which is what I call a one-page cheat sheet, and it's got the kiddo's picture, and it's very customized, and it has things like what are the behaviors they're struggling with, what is reinforcing to them, what things should be avoided. It's a quick reference sheet, and the BCBA is going to provide that to the other therapy disciplines so that they have that information, and it also will be in their treatment plan notebook just in case somebody's covering. They have that information also, and they're going to discuss any barriers they're seeing in terms of care. Then what will happen is they'll meet for 30 minutes, and then the parent will come in and join for the last 30, and the team will be able to discuss how their kiddo's doing in each service, so that they can see how the team's working together. So we launched this. We had our first one about 2 weeks ago, and it was absolutely wonderful. We got great feedback on it, and we will continue to do this and add this in and this is specifically for our ABA clients. So if you're here for therapies, we won't be doing that just for the therapies. It'll have to include the ABA piece. But we just want to make sure that the teams are working together and we're able to keep our model very collaborative and integrative.